Bleeding and wound care. There are first aid situations where you'll need to control bleeding and care for a wound before help arrives. First, let's look at how to control bleeding. We're going to take you step by step through the technique of controlling bleeding with direct pressure. 1. Put on medical exam gloves or improvise protection from contact with the person's blood if no gloves are available. 2. Place a sterile dressing or clean cloth over the wound. 3. Apply firm pressure directly on the gauze-covered wound for about 5 minutes. 4. Reevaluate the bleeding. If the dressing becomes soaked with blood, don't remove it. Add more gauze and keep applying pressure. 5. If needed, wrap a bandage around the wound to maintain direct pressure to control bleeding. Wrap towards the body. You will know that pressure is sufficient if the bandage is snug, but a finger can be slipped under it. Hemostatic dressings are special dressings treated with an agent that helps control bleeding. They can be used to control severe bleeding or bleeding in areas where a tourniquet can't be used. If direct pressure does not control the bleeding and you have a hemostatic dressing, apply it directly on the wound using direct pressure. 6. If appropriate, treat the person for shock and call 911. A tourniquet can be used when you are unable to control bleeding in a limb using direct pressure or a pressure bandage. Use a commercially made tourniquet if you have one. You can also make a tourniquet using a non-stretch cloth such as a triangular bandage. Let's review the steps to control bleeding with direct pressure one more time. Step 1. Put on medical exam gloves or improvise protection if no gloves are available. Step 2. Place a sterile dressing or clean cloth over the wound, or use a hemostatic dressing if needed and one is available. Step 3. Apply firm pressure directly on the gauze-covered wound for about 5 minutes. Step 4. Reevaluate the bleeding. If the dressing becomes soaked with blood, don't remove it. Add more gauze and keep applying pressure. Step 5. If needed, wrap a bandage around the wound to maintain direct pressure to control bleeding. Wrap towards the body. You will know that pressure is sufficient if the bandage is snug, but a finger can be slipped under it. Step 6. If appropriate, treat the person for shock and call 911. Now, we're going to show you the basics of wound care. To start with, wash your hands and wear gloves if available. Gently wash shallow wounds and abrasions with lots of warm or room temperature water, with or without soap, to remove dirt. Irrigate a deeper wound under large amounts of running water to remove foreign matter. Do not use alcohol, hydrogen peroxide, or iodine on a wound. Pat the area dry.
Are you allergic to antibiotic ointment?
No, I'm not.
Apply antibiotic ointment only to an abrasion or superficial wound, and only if the person is not allergic to it. Finally, cover the wound with a sterile dressing and bandage. Sometimes proper cleaning and bandaging of the wound is enough, and sometimes you need to seek further care. Have the person get medical attention if stitches may be needed. Wounds that may require stitches are cuts on the face and hands when the edges do not close together, gaping wounds, and cuts longer than 1 inch. Have the person get medical attention if they're not up to date with their tetanus vaccination, and remember that adults need a tetanus booster every 10 years. Also, seek medical attention if the wound later looks infected, if it's a deep wound or a puncture wound, and of course, if an object is impaled in the wound. In that case, leave the object where it is, bandage around it, and get emergency help. Now it's your turn to practice.